Less than 48 hours after calling off the strike, nurses at the University Teaching Hospital and Levi Mwanawasa General Hospital in Lusaka have been fired. When they reported for work, the nurses were shocked to be greeted by dismissal letters. According to a letter signed by Senior Medical Superintendent Dr. Lakson Kasonka, the nurses have been dismissed for participating in what he termed as an illegal strike, contrary to the terms and conditions of service for the public service. The nurses are shocked that they have been fired even after resuming work.
At 20 hours, they started giving people dismissal letters. We are very saddened by the government and the step which they have taken, because if a nurse is ready to take care of 6 patients that she is supposed to take care of, but we take off 106 patients.
Quite unfortunate that even after we have reported back to work, we should receive letters of dismissal, because at the end of the day, we said we're going back. That was what was requested of us to do.
Because we were simply expressing our views. We are the people who feel it.
Meanwhile, Resident Doctors Association President Wyson Munga is against firing of the nurses and calls for their immediate reinstatement.
No one should be victimized in this process, and let's just give chance to the process that government advocated for. That's the negotiations that enabled the nurses to go back for work. So we would love to strongly and urgently urge government, or probably advise government, to quickly or immediately rescind their decision so that the nurses can go back to work.
And Zambia Congress of Trade Union Secretary General Roy Mwaba has appealed to government to reinstate the fired nurses as they are essential workers. Mr. Mwaba has wondered why government has ignored the pieces of advice against firing nurses.
Nationally appeal to government of the Republic of Zambia to reconsider their decisions and reinstate the nurses. While this process of negotiations with the nurses was going on, there were adverts that were running in the Daily Mail, meaning there was a strategy to go ahead and sack the nurses, even when we as a labor movement were involved in appealing to the nurses to go back to work.
For about 10 days, nurses and midwives countrywide downed tools demanding for improved conditions of service and rectifying their salary disparities. The health workers were demanding 400% salary increments on the basic salary, among other demands. Naomi Ngandu, Muvi TV News, in Lusaka.